unmuted to encourage dialogue. So if you have any background noise that starts happening, we'd appreciate if you'd mute your phone, but if not, we're going to leave all the phones open. So you can either just speak up and ask a question, it'd be good to identify yourself, or another way to ask questions, on the bottom of your panel, there's a little tab called Questions. You can type your question in there and we will see it and respond to it. If you'd like any further information on any of the 17 projects that make up the Regional Catastrophic Preparedness Grant Program that are part of FEMA Region 3, please feel free to send me an email at jennifer.nugent@ahcusa.org, and I'll get you the appropriate personnel to contact. All right, at this time, I'd like to introduce Janet Clements. Janet is the program manager for the 2008 RCPGP project on the behavioral analysis study. Janet is the former Deputy Director of the Virginia Department of Emergency Management. In that role, she was the primary architect of the behavioral analysis study, which served as the cornerstone for all the other projects within RCPGP. Since leaving VDEM, Janet has unfortunately been able to continue to guide this project as well as the follow-on project of Shelter in Place. So at this time, I'd like to go ahead and send it over to Janet. Janet?
Thank you, Jennifer, and good morning to everyone, and thank you for joining us for our webinar featuring this new research that's been conducted by the University of Virginia on public decision-making during dirty bomb attacks in the National Capital Region. Now, some of you might be familiar with the earlier survey that was done by the University of Virginia that was primarily focused on, again, dirty bombs, but whether people would evacuate or shelter, and if they did evacuate, where would they go, how far out, and how would that impact the states surrounding the National Capital Region. So after that original survey, we found a number of people were very interested in how people's families, their children, whether they're in school or at home, loved ones, would impact people's decision to shelter in place if they were told to do so by authorities. Many people had the impression that, if something, a major emergency happened, having their children in school and being very separated from them, maybe if they were at work, would cause issues. So that's what we wanted. That, among other things, were the things that we looked at in this survey. Without going into any more details, because we do have the expert that's going to talk to you about that, I would like to introduce Dr. Tom Guterbach. He is the director of the University of Virginia Center for Survey Research, and he is the principal investigator for this new 2011 behavioral study of the National Capital Region. So now I'd like to pass it to Tom.
Well, thank you so much, Janet and Jennifer. It's been a pleasure to work with you on this project for the last several years, and exciting to be able to present the latest news from our research. I like to teach. I do that here at the university. I hate webinars because I can't see anybody. I can't see who's paying attention and who's not. It's not that you have to pay attention, but it tells me what I should be doing if people are going to sleep. I would like to encourage questions, although I have to turn off this little screen that shows me the questions, so I might need Jennifer to say, Tom, there's a question, and then I can pull it up and look at it. But also want to welcome you to just interrupt or step in on the phone anytime you feel like it, and I'll try to stop in a few places to see what questions you have. Before I move on to the next slide, I do want to put in a shameless plug for the Center for Survey Research. We are a full-service survey organization here at the University of Virginia. We're part of the university. We do a lot of work for state and local governments, for nonprofits. We do surveys by phone, by web, in person, and by mail. We do multi-mode surveys, and we help people design surveys and analyze results. So I just wanted you all to know that. I've been doing this for over 20 years. I'm the founding director of the center. I was not alone in this project. We have a number of co-authors here at the center who I do definitely want to give credit to. We couldn't have done it without this report that we wrote was written by a number of people, and then I edited it and put it together. I also especially want to acknowledge the funding that we had from VDEM and our colleague Joe Traynor at the University of Delaware, and of course Janet, who really has been the inspiration and guide behind this series of projects and helping us to make sure that our research is responsive to what actually people would like to know rather than just some academic exercise. Now, I'll go briefly over what we're going to do today. I want to talk a little bit about this survey, how it was designed, and also what motivated the survey, what were the research questions we were trying to get to. We'll look a little bit at how people communicate in the area. We'll look at what kind of jobs they have and what kind of places they work at and how that interacts with their preparedness, who's prepared and who's not in terms of where they work. Then we'll turn to the parents in our survey and find out what they think about their schools, whether they're aware of school planning and preparedness, whether they're confident in the schools, taking care of their kids in an emergency. And then we'll get to the heart of the survey. It'll take a while to get there, but we will eventually get to what I see as the heart of the survey, which is asking people what they would do in different scenarios. We systematically varied those scenarios, and then by seeing how people differ in their response depending on the circumstances, we learn a lot about their decision making. And so we'll then look in some detail at the factors that affect their behavioral response. In particular, will they stay, that is, will they shelter in place if instructed to do so, or if not so instructed, or will they take off and tie up the road system? And then I have some pretty basic and practical implications for emergency planners and managers. I don't want to deflate what I'm about to present, but I'd like to say that I don't think there's anything extremely surprising in what I'm going to be giving you. I think what's important about what I'm going to be showing you is that we're able to quantify and verify what have been hunches and see that most of our hunches about how people respond are actually can be tested and borne out and quantified so that we can really see the impact that would happen if policy changes or planning were able to affect the factors that affect people's decisions. We think that we can change people's response to an emergency if we can get the favorable circumstances in place that are needed. So let's look a little bit at that survey design and wrap up here. And I should mention, for those who are not aware then, that we define the National Capital Region in a fairly restricted way. It's not the full metro area, but includes D.C., the 2 counties in Maryland, Montgomery and Prince George, and then Loudoun, Fairfax, Prince William, Alexandria, and Arlington, and the independent cities that are enclosed in some of those counties. So our goal in doing this survey is basically to look at employees, people who have jobs. That's our target population here, and ask them what they would do in an emergency. How do employed people balance their commitments between work and their loved ones? How would they react if they're told, you should shelter in place for your own safety? And would it matter if the phones were working? How well prepared are they for an emergency event? Are they really able to shelter if told to do so? And then what have the schools done, and how are people confident and aware of what the schools have done to provide for emergencies? And what are the factors that would allow workers to shelter in place? And we're hoping that understanding this will help you all as you make decisions and implement policies and plans for some terrorist attack in the future. I have just, oh, there it is. Now, I want to take you back in time. As Janet mentioned, we did another survey a couple of years ago of the same region, a larger survey of 2,600 respondents. And in that survey, we asked people what they would do in a terrorist attack involving a dirty bomb. We had different scenarios, including one bomb that was far away from you and while you were at work. We asked people to imagine themselves to be at work. Or what if the bomb was just a mile away and you were told to shelter in place? And there were several compelling results that came out of that survey. First of all, if the bomb happens far away, a lot of people will hear that news and decide it's time to leave work, I'm headed home, or I'm headed to the hills, or I got to pick up my kids or something. Less than half of respondents would stay at their workplace if an event like that happened and they hadn't been told to shelter. Now, if they're in the impact area and they're told to shelter, you get fairly good compliance. The majority would shelter in place, although it's not great. It's not as many as stay at home if they're at home or when it happens. Most people would say they could stay in place for a full 48 hours. And the main reason they want to go is for loved ones, especially to pick up kids or get their wife or their husband or an adult member of the household. Most people say they would remain at their original location if they were assured that their loved ones were safe. I want to show you again from the 2009 survey, not from the current survey, what we found. So here are people who are imagining themselves to be at work, or if they didn't work, they were in some other building away from home. And in what it says minimum here, that's the minimum hazard level. That is, we tell them a bomb's gone off far away. You're not told to shelter in place, but this has happened. What are you going to do? And you see that only 41% are going to stay at work. About a third are going to go home. Some are going elsewhere, like to the school or to the store. And some are taking off for the hills or to a far or someplace they think is safe. In the moderate scenario, when told that they should shelter in place, or the maximum scenario, which means bombs are going off all over the region, in these hypothetical scenarios, you get better compliance, about 70% who will stay at work, and the rest doing various things to leave the workplace. We've done quite a bit of work. Jim Lambert, my colleague here at the Center for Risk Management and Engineering at UVA, he and his team have taken the 2009 results and done more detailed projections about what would happen to the road network if 50% of the workers take off in the afternoon because of a terrorist attack. And it's not a pretty picture. You'll recognize the Beltway, and here's Tyson's Corner. This is if one bomb went off at Tyson's Corner. Basically, the roads are at a standstill. Red means that the road is over capacity and traffic's not moving. So these are the findings that compel our current study. We're trying to figure out, well, if everybody's leaving work, first of all, what about continuity of operations? Are we going to have the things we need? And what are we going to do about that gridlock? Because these people are going to be traveling through the radiation area. They're going to be making it impossible for responders to get where they need to go. Pretty much of a mess. What can we do about it? So we did some focus groups, first of all, with parents, non-parents, exploring this whole issue. Everyone we talked to was employed in the region, and we asked them what they would do, and that helped us shape the survey. So we did another telephone survey. The target population, adults who work outside the home 10 hours per week or more, and they had to work in a fixed location, a building or something. We used a triple frame phone sample, which means that we did include cell phones, which gives us a very nice representative sample, including younger people who we might not reach if we had only used landline phones. We did do Spanish language interviews. We completed 816 interviews and have a margin of error, statistically speaking, of plus or minus 4%. And again, the geography is as I defined before. So let's start looking at some findings. Again, we'll look at communication, we'll look at where they work, we'll look at what they think of the schools, and then we'll get to the scenario part. Before I go on, I wonder if there are any questions about what we did or what motivated the study or about our 2009 study. Well, please feel free to ask at any time, and I'll continue. So the main form of communication that people normally use, guess what? It's a cell phone. 90% say that they use cell phones. They could pick more than one. 75% of workers in D.C. are using email. About half use landline phones. A lot of them don't use landline phones very much. Text messages is popular with about half the people. Social networking, Twitter, and so on, people are using it, but not large numbers, really. Not for normal communication. Now, if there was an emergency, we asked, what would you rely on the most to contact your loved one in an emergency? No doubt, cell phone wins this. Everybody says, I'll grab my cell phone, I'll be able to reach them. They've got their cell phone. 75% are going to use the cell phone, 10% will use a landline, and then others would choose other means. But then we said, well, what if your main way of communicating wasn't available? If the technology you normally use were not available, what would you use instead? Okay, I don't have cell phone, I'll use landline, or I'll use email. And then some people are saying I'll use cell phone because their primary method was some other, and they say, well, my cell phone is my backup method. So it gives us a bit of an insight of how important cell phones are to people's communication today. Now we asked people a quiz question. Which of these two things puts a higher burden on the cell phone system? Using a voice call, a regular phone call, as opposed to a text message. I'm sure you all know that the correct answer is that a text message puts less of a burden, that a phone call puts a higher burden on. And about half our respondents get that right. 50.7% are correctly saying that a phone call puts a higher burden on the cell phone system. 14% guess wrong. Some think it's the same. Many people don't know. So there's some potential here for education about how the system works and what puts a greater burden upon it. Let's look now at where people work. Now this is not big news if you study the demographics of the region, but if you are just thinking about it casually, you may not be able to visualize exactly what our workforce looks like. So first of all, what kind of building do people work in? Over half, about 56%, are in high-rise buildings, which we defined as 4 stories or more. About a quarter are in buildings that are 2 or 3 stories tall. 15% are in single-story buildings, and about 1% are in trailers and other temporary structures. Where do they work? Of course, they don't work where they live. Lots of people commute, so the largest number of workers is in D.C. Fairfax and Montgomery are the other big employers, and the other places, while they have a lot of population, don't have that big a share of the area's jobs. Now, everybody thinks in Washington that everybody works for the feds, and that's not quite true. About a quarter of our workforce is with the federal government. State and local government take up another 10%. Nonprofits, 15%. We don't have very many self-employed in our survey, only 1.7%, because remember you had to work outside the home. So a lot of the self-employed don't have their home office, and we did not talk to them because we needed people who were at a workplace outside in order for this thing to work. And very importantly, half of our workforce is in the private sector. So private sector companies are only about half the workforce in D.C. That would look different in another town. Most people work for big employers. 56% are with employers that have 100 more employees at that location. Another 5% with 76 to 100 employees. Excuse me. There are people, though, significant numbers, who work for smaller workplaces, and we'll see that that makes a difference in their preparedness. So let's look at preparedness. What are the current levels of emergency preparedness at work? Now, all of you have been working hard for years on make a plan, get ready. We know that there's been lots of planning, especially since 9/11. So where are we now in terms of thinking of all the workers in D.C., how many are at a place that has a plan and they're aware of it? So we asked people, does your workplace have an emergency plan prepared for something like the scenario we had just described to them? And about half, 48%, say definitely. So that's pretty good. But there's a lot of people who aren't sure about it. 22% say well, I think we have a plan. Others say probably not, definitely not, or they just don't know. In our report, we explore more specifically what elements of a plan they think are in place, and that's somewhat interesting too, but I didn't put it here. We asked this related question, how confident are you in your ability to shelter at work for 24 hours or more? And about 2/3 say, oh, I could do that. Plan or not, I could hang out at work if I had to for a day. Others are not so confident. We asked if their workplace provides critical goods or services, and about 1/3 of the workers say, yes, I work at a place that's really critical to the functioning of the community. Is your job necessary to the functioning of your workplace? And nearly half say they are. We think that may be exaggerated, but that's what people said. Other questions here?
We don't have any questions online either, so we're good. Feel
free to type them in as we go. So, okay, we know that about half the people say they have a workplace plan. They're definitely sure, but this turns out to vary according to some of these characteristics of the workplace that we just looked at. Hello. Every now and then my keyboard wants to freeze up and I can't advance, so let's see what happens. All right. Okay, what kind of place do you work for? Well, if you work for a private or for-profit company, which remember that's half the workforce, only about a third are aware of a plan. In federal government, it's 70%, and local government wins this race. The local government planners are most likely. I was thinking about that and wondering, are they doing a better job? Then I remembered, well, hey, who works for the local government? Firefighters, police, and school teachers. Those are the bulk of the employees. So they're working in places where emergency plans are clearly part of the environment. So that becomes less surprising when you see that number. The self-employed are not likely to have a workplace plan. Only a quarter say they have one in place. The confidence in their ability to shelter is doesn't vary as much. It's a little lower for private and nonprofit companies. It's highest for the federal government, and the self-employed, again, lag far behind on their confidence that they could stay at their workplace for 24 hours or more in an emergency. It varies hugely by the size of the company. So the long story short here, we've got pretty good planning in place in the big buildings and the big companies and in the government, and much less so in the smaller businesses out there, which employ a pretty substantial part of the workforce. In the little tiny places with 1 to 5 employees, only 17% say that they definitely have a plan in place for an emergency. And here it is by size of building. If you're in a high-rise building, more likely to have a plan. In fact, some buildings have their own plan. If they have a lot of little offices, they may have a building emergency plan. And of course, the larger companies and the federal agencies tend to be in the big buildings. Those in the single-story buildings and temporary areas, less than a third, are definitely covered by a plan. And this last one isn't all that surprising, but it's something to keep in mind. The closer you are to the District of Columbia, the more likely you are to have a plan. So it's really like organ pipes here as you go further out to Prince George, Prince William, Manassas, and out to Loudoun, and then those who are outside of that area, fewer and fewer people say, yes, we have a plan in place. So again, if you're in a big city and a federal agency in D.C., you almost certainly have a plan in place, but there are a lot of people who don't have it. This slide in text pretty much summarizes what I just said. Government people are more likely to have a plan. Bigger places, people in high rises, people who are closer to the district, these are the ones who are more likely to be aware of a workplace emergency plan. Well, let's turn now to the schools. A lot of the people we talked to were parents, and we wanted to see what parents had to say. About 41% of the people we talked to have children under 18 in the household. We had the focus on their youngest child, so we had a pretty good spread between those with preschoolers, kids in elementary school, and teenagers. Most are in public school, but there's a substantial number in commercial and public daycare and in private school. And some who aren't in school at all, they're staying with grandma or something if they're preschoolers. There's not a lot of problem of communication that we could see. 8 out of 10 are signed up for emergency notification with their school systems. 9 out of 10 say they have a way to get information about an emergency that involves school. And most of this is done by phone. Normal communication with the school we asked about is about 80%, or 3/4 are using the phone. There's a lot of email with school and school teachers as well. Of course, visiting in person are other ways to communicate. In an emergency, people turn to the phone, but this probably includes those incoming phone messages that the school systems send out nowadays. Email is also going to be used a lot in an emergency. Text messages, let me go back to that slide, not so much. Only 20% would use a text messages in an emergency. So that's, again, something that we might want to work on. Does your child's school have a plan in place for emergency? We have more or less assumed, we're not sure it's correct, that all the school systems do have emergency plans in place. And so what's really at stake here is not do they have a plan, but do parents know about it. Less than half of parents say, my school definitely has a plan in place. 35% think, oh, they probably do, and others aren't sure at all. We asked those who said definitely or probably if they were familiar with the plan, and about 60% said they were somewhat or very familiar with the plan. So that's 60% of the 40%, so that's about a quarter of parents who say, oh yeah, I know there's a plan and I know what's in it. When we asked what parts of the school plan they knew about, for those who said they definitely or almost certainly had one, they knew that there were bathrooms, they had a first aid kit, they knew they were having fire drills, they thought that there were electronic file security protocols and ways of contacting with staff. What I found most interesting here is that there's very little clarity among parents that there's a communication plan for contacting parents. 30% think it's definitely there. Another bunch, about 30% think probably so. It gets you over 60%. 40% really don't know if that's going to happen or not. I think that's a key part of these plans that's not been well explained to parents. And we found that elementary school parents are most know about a plan. For the preschoolers, much less likely. Again, a lot of these kids are in small preschools and daycares, small institutions that aren't part of a big system that may not have a plan in place. How confident are people in their schools taking care of their kids? Most people do think they could take care of their kids for a day, for 20 to 24 to 48 hours. Most people are down here. Only a few people doubt that that's the case. 65% are confident that the school could care for their children for up to 24 hours. There was no significant difference among the counties in the trust in schools in this respect. There were some racial differences, though, with significant amounts of distrust among African American respondents and some other differences by ethnicity. What do you think your school would do if the child's school were in an emergency where they were told to shelter in place? 80% think they would lock down the school, but 20% think if they showed up at the school that their child would be released to them. It's not clear that that's true, but that's what parents think. And some people think they would just let the kids go, very small number. We asked people about what they thought the schools should be doing. What should the school's primary goal be in an emergency? Should they take care of the children? Should they be keeping children in their care and take care of them to the best of their ability, or should they be trying everything they can to reunite children with their parents? Well, most people said, take care of the kids, please. But nearly 15% said, no, they need to get my little darling back to me. And we'll look at in a minute what those people are going to do in an emergency. So I'm at another point of pausing. I'd like to pause yet again and to see what questions may have come to your mind as we look at all these things. Well, I've either bored you completely or totally informed you, so we'll find out later when we get to the end of this. So we're ready now to plunge into these event scenarios, and I want to take a couple minutes to set up what we actually did. The focus was on dirty bombs. That's the only kind of terrorist attack we looked at because it is a shelter-in-place scenario. We were really looking at primarily at whether residents would decide to stay at the workplace or move on or move out in this emergency situation. We didn't do as much follow-up as on the earlier survey about where they would go and how they'd get there and so on. We felt we had good information on that. We used 3 scenarios that are at increasing hazard levels. Again, the minimum scenario means that one bomb goes off far away from you, and you're not told to shelter in place. It's really not a shelter-in-place scenario. In what we call the moderate scenario, which is pretty serious, a bomb goes off a mile away from you, wind is blowing toward you, you've been told to shelter in place, or in this survey, sometimes that your loved one has been told to shelter in place because the bomb is near them. In the maximum scenario, bombs have been going off all over, whoops, now there's one right near you. You've been told to shelter in place, and so has nearly everyone else. So all hell is breaking loose. In this survey, each person got to do 2 scenarios. So our 800 respondents did 1,600 different scenarios. So we had 1,600 times here where we asked somebody, are you going to stay or are you going to go? Now, when we look at that minimum scenario, we had 2 versions of it, A and B. Again, that's the one where the bomb's far away, you're not told to shelter in place. We first asked about it whether if you had phone service working, and then we said, well, now what if the phones were not working? You couldn't use your cell phone to access the internet or call someone, and you can't use the regular phone or the internet either. What are you going to do? In the maximum scenario, where the bombs are going off all over, we had the same variation. We said, what about if the phones are working? Now, imagine the phones aren't working. What would you do? For the moderate scenario, with a single bomb going off nearby, we varied that in a different way. First, we said, well, the bomb's right near your workplace. You've got to stay in place. But your loved one, the kid at school, your spouse, your aging parent, they're fine. Nothing's happened where they are. They're not told to shelter. And then the alternative, which we asked them to consider right after that, was you're fine. You're not told to shelter in place, but uh-oh, the bomb has gone off right near your kid, right near your mom, right near your spouse. They're told to shelter in place. What are you going to do? And we actually varied the order of that so that there were 4 paths through the survey. You could either get it where you were sheltering in place and your loved one wasn't, that's path 2, or you could start with the kid being sheltered, having to shelter, and you not, and then switching to the opposite where you were sheltering and they were not. It turned out that the order didn't vary very much, so we're just going to consider those moderate scenarios together. Paths 2 and 3 are combined in this presentation. So we finally get to the bottom line here is, will they stay or will they go? We already have seen that a lot of people will leave in a minimum scenario. We knew that from the earlier survey. But the question is, what are the factors that make it more likely that these workers will stay in place? Well, it turns out that having the phone connection is very critical. It makes a really big difference. So we're looking here at people who are in the minimum hazard level. Once again, a bomb has gone off far away from you. They're told to shelter in place. It doesn't affect you or your loved one, and you're free to go. What are you going to do? Well, if they have phone service, about 60% are going to stay in place. And this is a higher number than we had in the earlier survey, and that's easily explained because in that survey, people were imagining they were at work, including people who didn't have a job. Here we were only talking to workers who really have a job. They're thinking about their workplace, and I guess they were better able to imagine staying there. But we still have over 40% who are going to leave or possibly leave, aren't sure they're going to stay if there's a phone in place. So looking just at those who leave immediately, about a third say, I'm out of here if a bomb goes far away. Now, if we then ask them what happens if there's no phone, this goes up substantially. Over half of the workforce is taken off because they want to find out if their kid or their spouse is okay and they don't have a good way to communicate. If we turn our attention to that maximum scenario, bombs nearby, bombs far away, really bad stuff going on. People will, and you're told to shelter in place. Well, people are compliant. Only a fifth of workers say, I'm getting out of here anyway. I wish that number were lower, but it's not as bad as some people have feared. But if there's no phone in place, it goes up by half, from 20 to 30%. Another 10% are leaving, a very substantial change. So having that phone communication and knowing what your loved one's doing is really important to people's decision making. Here's another slide that summarizes it across both the minimum and maximum hazard levels. An interesting side light here is that 4%, if there's a phone, say, well, I'm going to call and see if my loved one's okay. If there's no phone, they understand that they can't do that, and they say, well, I'll get the information some other way, although it's not clear what they're going to do, try to get on the internet, wait for someone else to call, I don't know. But you can see there's, again, that really big difference between how many are taking off immediately when we add up these two scenarios, between 25% to 42%. Now let's look at the other thing we varied. This is that moderate hazard level, and remember we had one situation that says respondent SIP, so that's when if you're the respondent, you're at work, mom's right near you, you've got a shelter in place, junior over at school, he or she is just fine, what are you going to do? And then the alternate, loved one shelter in place, nothing happening where you are, but over where your loved one is, they're under shelter in place orders. Well, you can see what happens. In that latter situation, lots of people are taken off to go to try to get there, I guess, and to help, even though that's a restricted area, they're taken off. If told to shelter in place and their loved one is not in danger, we have not so many people leaving. We have very good compliance here, only 16% saying that they would leave. So if we can get people in that good place where there is a place where they're told to shelter and everyone else is fine, you're not going to have that many people leaving. I think this is one of the most important slides in this presentation. Now here we're looking at whether you're aware of an emergency plan. And we're putting all the hazard levels together now. That's why you get these fairly high numbers leaving immediately, because we're including those people in the minimum scenario. We've seen that's when lots of people leave, as well as those in the moderate and maximum scenarios where those numbers leaving are less high. And look how it goes across this table on the bottom. The people who say, there was about a little less than half, remember, about half our workforce says, I definitely have an emergency plan at work. Only a quarter of them are leaving under all these scenarios. Those that say, I don't have a plan, for sure, half of them are leaving. This is a really big difference based on the awareness of the work emergency plan or its existence. If people think that their workplace is critical to the functioning of the community, they're more likely to stay in place. In the critical workplaces across all scenarios, about 23% are leaving immediately. That number is quite a bit higher for those in the less critical workplaces, 37%. I expected that it would matter whether you thought your job was critical to the workplace, but that turned out not to have an effect. And this is not surprising at all. Those who are thinking of a child as their loved one are more likely to leave than those who are thinking of an adult. So the adult is assumed to have some other resources. The child, the parent thinks, boy, they need me, I've got to get there, and so they're more likely to take off. Awareness of a plan at the child's school has an effect, although not as strong as the workplace plan. Those who are sure that they definitely have a plan at school for their kid, only 36% are going to leave, and we're talking here about the parents, not everyone. This is parents only. So 36% of parents would take off and leave work under all hazard levels. If they think there's definitely a plan, the numbers are higher for those who probably there's a plan or I'm not sure. If you're confident that your child can be taken care of at the school, you're less likely to leave work than if you're not confident. If you're not confident, half the parents are taken off. If you think the primary goal of the school is to reunite you with your child, you're much more likely to leave than the ones who think the job of the school is to keep kids safe. Remember, this wasn't a lot of parents. It was about 15% of parents who said, they should get me back with my kid. But those are exactly the ones who are going to take off to make that reunion happen. Well, we're running down on time, and that's okay because we're getting toward the end here, and I want to summarize what we've seen in these scenarios and then look overall at what I think these some of these findings are telling us. So just as in 2009, if an incident occurs and people are not told to shelter in place, a lot of people are going to leave work. About 44% would leave work immediately if it's near their loved one and they are not told to shelter. On the other hand, if they're told to shelter in place, about 80% will stay at work, especially if they feel their loved one is not in danger from the incident. If telephone service is not available, the number leaving work increases substantially. You see here the numbers that change from the minimum scenario. These are the percent leaving work immediately, 33 to 56% in the minimum scenario, from 20 to 31% in the maximum scenario. Now, workers are more likely to leave immediately if they don't think their workplace has an emergency plan in place, if their workplace doesn't perform a critical function, and if their loved one is a child. Parents are more likely to leave if they're not sure about the school's emergency plan. They're not very confident that the school can care for the child. They have to have a lot of confidence. And they think that the school's primary goal should be reuniting children with their parents. That also makes them more likely to leave. About all these findings, I think they do have some practical implications that I want to suggest for your consideration. Reviewing once again, most will shelter in place if told to do so. Many will leave if the incident occurs elsewhere and they're not told to shelter. And one of the primary drivers, clearly, is the concern they have about their loved ones, and as well as whether there's a sufficient preparation for them to stay at work. Those with young children are especially affected. Not surprising, but very clearly specified and quantified in this survey. Confidence in schools is fairly high across the NCR, but those who lack confidence are less likely to comply with the shelter-in-place instruction. Local and federal governments have the highest confidence and awareness of their workplace emergency plans, and half of respondents are unaware that text messages use less bandwidth than text messages. So we've seen that workers are much more likely to leave the workplace if telephone networks are not functional. We also saw, by the way, that they overwhelmingly are relying on their cell phones in an emergency, and most are going to make a voice call and not text. So it seems clear that if you could educate the public that text messages place less of a burden on networks than voice calls, this would help avoid a fatal crash of the cell phone system. It's also the case that there are technologies, cell on wheels and so on, that can provide temporary capabilities to boost the capability of a cell phone. This has been done for planned events, and maybe we should be looking at some investment and facilitation of that capability for emergency use as well. So if everybody's going to be on the cell phone, maybe we can be ready for that.
Tom, this is Jennifer. We had a question online. One of the questions was, did the survey take into account commuting distance or means for commuting? For example, commuters are farther away, maybe more likely to shelter in place at work than near commuters.
Yes, that's a good question, and the answer is we did. And that's in our full report. Dave, I have someone here. There's a copy of the full report on the printer out there. And I'll have that I can have that for you in a moment. I meant to have that in front of me. I believe people who take the metro are more likely to work, are most likely to shelter, and people who take the bus are least likely. Now that may be partly demographics. So we have information in the survey on where people work and where they live. We can get a rough commuting distance. But I did not run it by that. I haven't run specifically by commuting distance, but we have looked at it by how they get to work. Is there another question? Let me go on with this summary of some of these implications, and I'll welcome further questions as we wrap up. So we saw that workers are more likely to leave when their workplace doesn't have an emergency plan or if they're unaware of such a plan. We asked them, do they have one? And if they said no, it either means they don't have one or they don't know about it. So the big organizations mostly have plans. Probably what you need to do with the big enterprises is help them tell their workers there is a plan. But for those smaller businesses and smaller buildings, probably we could help to create plans there and make people aware of that so they're less likely to leave. What about parents? Well, they're more likely to leave work if they aren't certain that schools and daycare centers have emergency plans and they're not confident that they can take care of their children. So they need to make parents aware of the school emergency plans. Again, we think all the systems have these plans. And daycare centers, which probably don't have such plans, probably need help in creating them. They may have a fire, they'll certainly have a fire plan, but are they going to have a plan for sheltering in place? Now, since you can't necessarily reunite children with their parents in a shelter-in-place emergency, schools need to be able to drive home the message that their primary responsibility in an emergency is to keep the kids safe. We're not necessarily going to try to get you back to junior. We're just going to let you know that junior's okay. And schools could do a better job of letting parents know that the kids are going to be safe if they have to stay there for a day, and that they can also learn how their child is. So maybe there are some technologies that are going to help for not the general communication of here's the situation at the school, all the kids are sheltered, but more specific information. Your child is fine, we've talked to them. I think that's what parents would really like to hear. Right now that's hard to do, and I don't know if there are technological solutions that will help with that. So that's some of the conclusions I've been able to glean from this, but it's much better to talk to the actual experts on emergency management, and that's the people who have been listening so patiently for these 45 minutes. So I'm going to be quiet at this point and wait for further questions and comments from you.
Tom, there's another question that came online. Do school districts have a legal obligation to release children to their parents?
My friend Dave here may know. I think we talked with some emergency managers. I think that they do, but I believe that if there is no, I think that you know, where the schools have played this all out is not for dirty bombs, but for the Columbine incident, you know, for the shooter incident. So if there's a clear danger to the child outside the border of the school, I don't believe they, even if the mom's knocking on the door saying, I want my kid, I think they can say, we must protect your child. I think I'm not sure of this answer, but I remember a discussion of this along those lines. Dave, do you have a comment?
I spoke with Fairfax County Emergency Manager and for the Fairfax schools, and he, according to him, had made arrangements with the police that if they ever were in lockdown situation, that the police had said that they'll support the school in preventing parents from coming to the school and trying to find a way to get their kids out of the school, because once you open those doors, every child in that school, then their health could be potentially compromised. And so I'm not sure about the actual written law, but at least from Fairfax, I got the distinct impression that law enforcement would support schools in keeping their doors closed and ensuring the health of every student in that school.
And you have to imagine a yellow tape area too. So imagine the dirty bomb went off near the school, so there's an area, you know, the cop car is going to be across the street, not letting people in because of the contamination and so on. And saying, oh, my kid's in the school, I have to get her, isn't going to get you through that line. That's my perception of it, but we need a lawyer or two to help us know what's really going on, and the schools certainly know about that. Is there anyone online who has more information on this? Who could share it? Jennifer, are you seeing any more questions? I'm unable to see them before mine set up. I'm
yes,
sorry.
I'm sorry. I was muted. There is another question. Did your survey ask the businesses that have a plan if they have exercised the plan?
No, we have not. I think we did. What we asked was, and I think I can find it here in the report. We asked the respondents if they had, if there were practice drills as part of the plan. So 77 of those who said that their, of those who said that their workplace definitely has a plan. These are the ones who got the follow-up question. 77% said that they had held practice drills, 10% probably, and so on. So the great majority of those who definitely know they have a plan say there's been a practice drill. You could infer that one of the ways they know that there's a plan is that when they have a drill. So that's the best I have. We didn't talk directly to the businesses or the planners about their plans. By the way, we also asked about spouse's workplace. If your spouse works, we asked, does he or she have a plan? And it was about the same level of awareness, not as much knowledge, but a similar degree of coverage for spouses. One thing I haven't mentioned is that the full report is available, and Jennifer, are you able to give us details on how that will be circulated?
Yes, in fact, that question just popped up on my screen also. The full report and this PowerPoint will be sent out after this call to all attendees. A link will be sent out where you can download both the report and the PowerPoint slides. In addition, we are going to have this webinar. We're going to schedule it again because we realize that there's a lot of vacations, et cetera, that happen in August. It's going to be scheduled again on September 13th at 2 p.m. We'll be sending the same large group a second invitation, and we do want to invite people to send that to their emergency management, homeland security, fire, police, et cetera, colleagues, so they can join. They can join also. So, I did want to say that.
Hey Jennifer, this is Janet. One other thing, since so much of this study impacts the school systems, we certainly would encourage any of you to pass this information on about the second webinar, about this report to them as well, because that's an audience sometimes that's a little harder to reach, especially at local government. They're kind of separate from the other parts of local government. So anything that you all can do to help us get them aware of this survey and helping them see some of the results we think would be very valuable.
Janet, do you also want to give a short promo on the upcoming webinar on the 10th? Well, I have you here.
Yes. We have another webinar that's part of this overall project. One of the questions, all this what we call phase two work, which this survey you just heard about today is part of that phase 2. We also had a request by fire chiefs after the original survey. They were very interested as to whether first responders, emergency responders would show up to work in a catastrophic event, especially when everyone or many people are being told to shelter in place. What would their first responders do? So as part of this, we went to the University of Delaware's Disaster Research Center, and they did research on almost 200 studies that have been done and surveys on what would first responders do. And so next week, you will, on the 10th, we will have a presentation by Dr. Joe Trainer on that research. And it's very interesting, I think, and it talks a lot about role conflict and role strain and role abandonment during emergencies. So I encourage any of you, if you're interested in that topic, to make sure you attend that seminars or webinar as well. And we also have a report that we will be sending out on that particular research.
Okay, I do have a couple more questions for Dr. Gudebach. The next question that just came up, did your survey ask if commuters who drive have a disaster supply kit in their cars?
No, we did not. But the prior survey asked some related questions. They asked if you had a kit at home. We asked that last time in the 2009 survey, but not a go kit in the car. So we have not included that question. We did ask where they go, if they take a car, how many would be in the car, and there were some kind of qualitative questions. Is there anything else you would need, and so on, that might shed a little light on it. You look in the 2009 report for some shreds of information there, but we did not directly ask that question.
And if anybody would like to see the 2009 full report, we also do have access to that, so we can also post that. Okay, another question that just came in is how likely, a feeling of how likely would the results from this survey carry over to other hazards?
Well, I'm not sure I know. I think that we gave a fairly detailed description of this hazard to the respondent. I did not take time to read it all to you in detail, but it takes about a minute and a half to read. And it says, that there's contamination and that it would cause cancer in the future, and there's radioactive dust, and that you could be sheltered by staying in place. So we made a fairly strong case that there's danger if you go outside, if you're in the shelter-in-place scenario, not if it's far away. So I do think that this would generalize to other shelter-in-place scenarios fairly well. But there are of course many hazards where your degree of danger isn't affected much about whether you step inside or outside. The one place where I think it has a lot of potential application is for another hazard we're all very much worried about, which is the improvised nuclear device, or a small nuclear attack, where there really is a very dangerous fallout, and even stepping outside to see what's going on could be a fatal decision for the person. That would involve a greater degree of danger than we described in going out. One thing that was interesting to me in looking at all these results, to let me go on a little bit on this question, is that these scenarios present the person with this difficult decision: should I stay or should I go? And everything we know about this from people's behaviors in real emergencies and from all the studies that have been done is that people are fairly deliberate about that they seek information, and then based on information that they get from different sources, and usually not just from one source, they make their best decision. They act pretty rationally in emergencies. The idea of everybody panicking is very rarely borne out in reality. So when they look at that decision when it's a dangerous scenario, let's say it's radioactive fallout, either from a dirty bomb or from a nuclear device, they're thinking, well, is it going to get me if I go out there? But oh my gosh, is it going to get me if I stay in here? I don't have duct tape to, I can't seal off all the vents. I'm in an old building. Heck, half the windows are open right now. They're trying to trade off these two dangers. And what happened in these tests of the scenarios is that when we increase the apparent hazard of the scenario, and we did a lot of that in the earlier survey, we don't get a lot of change in how many people are leaving. And what I think what's happening is that they're seeing a greater danger of leaving, but they're also seeing a greater danger of staying, and the two kind of balance each other out in a higher hazard level. So very cautiously, based on that insight in the data, I would say I think this is somewhat generalizable to different hazards, because they're going to see, as long as the balance of hazard of staying and going remains the same across the hazards. That's the professor's long-winded way of saying, I don't know.
At this point, I don't have any more questions on the screen. Any more questions from the general audience? All right, if there's no further questions, just a few final items. I'd like to thank Dr. Gutebach from the University of Virginia for giving the presentation. I'd like to thank Janet Clemens for putting this all together. As we just stated, We will be sending an email out with a link to the full report and to the presentation, the slide presentation. We will also be having a follow-on, this webinar, a follow-on one on September 13th at 2 p.m. We will be sending out an invite for that. We ask that you distribute that to other folks as you see appropriate, perhaps within your school districts or within the surrounding area. And finally, you should have all received an invitation to the August 10th webinar, which is another portion of the behavioral analysis project that deals with reporting to work issues. And then I'd like to turn the phone over to Janet for parting words.
Well, certainly we appreciate you being on the call. One other webinar we will be scheduling in September, we haven't gotten the date yet, is that you saw that early slide with all the red on the highway, and Dr. Gudebach mentioned one of his colleagues, Dr. Jim Lambert at University of Virginia, that did that piece of research. So what he did was take the original survey and use the transportation models to show what impacts it has on the roads. There's some very interesting data that came out of that. So we will be scheduling a webinar there sometime in the first several weeks of September, so that folks will be back from vacation after Labor Day. So keep your eyes out for that as well. And thanks again for taking your time to learn about this recent survey.
Thank you, everybody, and that concludes this webinar.
Thank you.